here we are going to discuss few questions and answer about gastrointestinal management. The first question is here. A nurse is caring for a client on medical unit. Which tasks should the nurse implement first? Number one, change the abdominal surgical dressing for a client who has ambulated in the hall. Right. Number two, discuss the correct method of placing Montgomery straps on the client who have with the UAP. Number three, assess the male client who called to the desk to say he is nauseated and just vomit. Number four, place a call to the extended care facility to give a report on a discharge client. So out of 4 patients, who is most emergencies or what are the prioritizations? So the correct answer or number and rationale for why it is the correct answer we will discuss, right? And also the rationales for why the other possible answer options are incorrect, we will try to find out here. So number one said, change the abdominal surgical dressing. So this client should be seen in a timely manner. Surgical dressing for a client who has ambulated in the hall. Right? This is I said this client should be seen in a timely manner, but not before the client who is vomiting, because vomiting can cause fluid loss, right? And when fluid loss, patient lead to hypovolemia. Hypovolemia lead to the shock, hypovolemic shock. So 3 is it our choice. So why number 2 is not an answer? Because this can take some time and should not be hastily completed, because the nurse must know the task is being done correctly before delegate to the UAP. So number 2 patient take care of the UAP. When you decide or select what patient take care by what UAP, delegating is important. So the nurse manager already know this UAP is enough to deal with this patient. Number 3, I said answer because this client has experienced a physiological problem like nausea and vomiting, and the nurse must assess the client and the MSS to decide on possible interventions. Maybe this patient needs saline solutions. So our answer is number 3. Right? And number 4, place a call to extended care facility to give the report on a discharge plan. So the nurse could call extended care facility after assessing the client who has vomit. So if nurse take care of the patient number 3 and then take care of number 4 and call, it's nothing problem. And number 4 patient will not die if do after 5 minutes later. Next question. The nurse is preparing a client diagnosed with peptic ulcer disease for a barium study of the stomach, and esophagus. Which nursing intervention is the priority for this client? So again, I said diagnose peptic ulcer disease and patient go for barium study. Which nursing intervention is priority for this patient? Number one, obtain informed consent from the client for diagnostic purpose and discuss the need to increase the oral fluid intake after the procedure. Also, explain to the client that he or she will have to drink a white chalky substance. Explain. And number four, tell the client not to eat or drink anything prior to the procedure. So which is the answer? Right? So let me show you and tell you. So obtain informed consent from the client for diagnostic procedure. It is important, but why it is not the priorities? So barium study of the upper GI is an X-ray procedure and does not require the client to sign an informed consent form. We learn it from these questions. So number one is not answer. Let me recap it. As I told you, a barium study of the upper GI system is an X-ray procedure and does not require the client to sign informed consent form. So number one is not the priority. Number two is why not? Because the barium can cause constipation after the procedure. Therefore, the client should increase the fluid intake. But this is not the priority of interventions. So oral fluid is important, but not the priorities. Number three is not answer because the client will have to drink a white chalky substance, but the priority intervention to make sure the client is nothing by mouth. Number four, tell the client not to eat and drink anything prior to the procedure. So this is the answer. Again, why this is the answer? So if my patient eats something, all procedure will be stopped. If my patient eat, we will not go for barium study. So no question come about the informed consent. No question come about the fluid intake. No question will come about the drink something white or chalky substance. So it is priority. Tell your patient, educate them not to eat or not to drink anything prior to the procedure. Next question here. Which client warrant immediate intervention from the nurse on the medical unit? Number one, the client diagnosed with dyspepsia who has irritations and blockings. Number two, the client diagnosed with pancreatitis who has steatorrhea and pyrexia. And number three, the client with a diverticulitis who has a felt lower quadrant pain and fever. Number 4, the client with a Crohn's disease who has right lower abdominal pain and diarrhea. So out of 4, which is the priority? Which patient is the most important or prioritizations? Right? So first of all, number 1 is not the prioritization answer, because the nurse would expect the client with dyspepsia to have blanching or bloating. It is very natural or expected sign, right? So therefore, the client does not, need to immediate intervention, because we know that dyspepsia patient should be have a blockings or blanching. It is, we expect it. Number 2, the client diagnosed with pancreatitis who have a steatorrhea and pyrexia. So number 2 is not an answer, because the nurse would expect the client with pancreatitis to have a steatorrhea. What is steatorrhea? Steatorrhea means fat mixed with stool, and pyrexia means fever. So therefore, this client does not warrant immediate intervention too. And number 4, the client with a Crohn's disease who have right lower abdominal pain and diarrhea. This is the answer and priorities, because the client with Crohn's disease should be asymptomatic. And so pain and diarrhea warrant intervention by the nurse. And pain could indicate a complications. And because of complication, patient can chance to develop tearing or perforation of GIT and lead to the intestinal obstructions. So number 4 is the answer, right? So next question here, which behavior by unlicensed assistants, oh no, we have this question. The nurse and UAP means unlicensed assistive personnel are caring for a client on a medical surgical unit, which tasks should not be assigned to a UAP, or we call CNA or HHA. Number 1, instruct the UAP to feed 69-year-old client who is experiencing dysphagia. Definitely, it is the answer I want to tell you. First of all, patient is 69 years old, not a stable, very unstable emergency, because of patient has a chance of experience dysphagia, right? So the nurse should not delegate to the UAP feeding a client who is not stable and at the risk for complications during the feeding. As a result of dysphagia, right, we do not give this patient to UAP. And this requires the judgment that the UAP is not expected to the process. So definitely this is the choice. Regardless, still we do not read the other options, but we are sure this is not the patient for UAP. Number 2, require UAP change the linen for 89 years old client with a fecal incontinence. So bed making. So UAP can change the linen for the client who are incontinence. Therefore, this start should be delegated to UAP. Right? And number 3, tell the UAP to assist 55 years old client with a bowel management program. So UAP can assist the client to the bathroom and document the result of the attempt. So bowel management means routinely go to the toilet, right? So it is easy task for UAP. Number 4, ask the UAP to obtain the vital sign on a 72 years old client diagnosed with cirrhosis. So UAP can obtain the vital sign on a stable patient because 72 years old diagnosed the cirrhosis, very stable patient, right? But number 1 is the answer. Next question, which behavior by UAP require immediate intervention by the nurse? So out of 4 options, what are the answer? Right? So number 1 said UAP is refusing to feed the client diagnosed with a acute diverticulitis. So UAP doing something wrong, so nurse should interrupt for intervention. And number 2, UAP would not place the client on the bedside commode who was on bed rest. Number 3, UAP placed a client with a continuous feeding tube to the supine positions. And number 4, UAP placed sequential compressions device on the client who is on strict bed rest. So number 1 is not an answer because the client diagnosed with diverticulitis should be nothing by mouth. Therefore, UAP should not feed a client. So refusing to feed because patient is acute condition. In acute condition, we do not give them any food. We tell them not to take food, nothing by mouth. So this action does not warrant immediate intervention. Number 2, the UAP should not allow the client on bed rest to use the bedside commode. Therefore, this does not warrant immediately intervention by the nurse. So UAP should not place the client on the bedside commode who was on bed rest. So nothing wrong. She's okay for doing. Number 3, UAP place the client with a continuous feeding tube in a supine position. Definitely, it is wrong. Client with a continuous feeding tube should be in a Fowler position or high Fowler positions to prevent the aspiration pneumonia. So this action requires immediate intervention by the nurse. So our answer is this one because it is wrong, right? Supine, not supine. Fowler position or high Fowler positions to prevent aspiration pneumonia. Number 4, the UAP can place sequential compressions device on a client Therefore, this does not warrant immediate interventions. Next questions. So here the question answer we're following: prioritizations, delegations, and management of care for NCLEX RN board exam. Super important for our board. Number 6 here. The nurse is concerned about the documentations for blood administrations, and other staff members agree the documentations is cumbersome and needs to be revised. Which action the most priorities for the nurse to implement first? So number 1, discuss the blood administration flow sheet with the chief nursing officer. Number 2, contact individual to help design a new blood transfusion flow chart. Number 3, learn to adapt to the present form and do not take any further actions. Number 4, volunteer to be on an ad hoc committee to research alternate flow chart. So the answer is basically from here, number 4. Why number 4 is the answer and why other is not an answer? Let me explain. So number 1, the nurse should go through the chain of commands when attempting to make a change, right? So number 2, we do not choose the answer because this may be an appropriate action at some point, but this would not be implemented until after assessing the old form and identifying the area to be changed. And number 3 is not an answer because the nurse should be a chance change the agents. And number 4, we said the answer because the staff nurse should be a part of the situation to a problem, and volunteering to be on a committees to peers is the best action to effect a change. So volunteer to be the ad hoc committee to research alternate flow charts. Right? So volunteering to be on a committees to peers or of peers is the best action to effect change. Next question here. The charge nurse is transcribing HCP order for a client schedule for a barium enema. In addition to the radiography, department, which department of the hospital should be notified of the procedure? Number 1 said the cardiac catheterization department. So because of this procedure is performed in the radiographic department and is testing, and I said testing this patient or gastrointestinal systems, the cardiac catheter lab does not need to perform the procedure. So, cardiac catheterization department, no, because my patient is a barium enema. It is GIT problem. I have to go gastro, not cardiac. Which department of hospital should be notified of the procedure? Gastro, not cardiac. Number 2, the dietary departments. Number 3, nuclear medicine department. And number 4, hospital laboratory department. Let me tell you. Number 1 is not an answer, I told you. Number 4 is not an answer because this procedure does not involve the clinical laboratories. Therefore, this department does not need to notify. Number 3, the procedure is performed using the barium or gastrographin. So this is a nuclear medicine. So nuclear medicine department does not need to inform of this procedure. So number 2, dietary department. So the client must be nothing by mouth at least for 8 to 10 hours before the procedure. Therefore, the dietary department should be notified to hold the meal straight. So do not send the food to the unit because my patient going to gastrointestinal unit for barium enema, right? So do not need to send the food. So our answer is the number 2 is the best choice. And next question here. The charge nurse is making assignment on a medical unit. Which client should the nurse assign to the graduated nurse? So here are the 4 options. During the delegating, we have to choose. So number 1 said, the client who has received 3 units of pegged blood cell. Number 2, the client is scheduled for a esophagogastroduodenoscopy in the morning. Number 3, the client with a short bowel syndrome who has diarrhea and potassium level 3.3 milliequivalent per liter. And number 4, the client who has just returning from surgery for sigmoid colon. So first of all, which patient is best for the graduated nurse out of 4? Number 1 said this client is unstable, right? Receiving 3 units of pegged blood cell. So this client is unstable and should not assign to a new graduate because this patient is not stable. And number 2, the client's schedule for a gastroduodenoscopy in the morning. So this is patient is stable. Some routine procedure before preparation before the scopy. So this client is being prepared for a test in the morning and is the last and at least acute of the clients listed here, maybe. The new graduate should assign to this stable client. So number 3, the client who is short bowel syndrome, who has a diarrhea and potassium is 3.3. So This client is hypokalemia, 3.3. Also secondary to diarrhea. Because of diarrhea, hypokalemia developed. And also this patient has a chance to develop cardiac dysarrhythmia because of hypokalemia. And this client should be assigned to a more experienced nurse. And short bowel syndrome is an male absorption disorder caused by surgically remove of the small intestine or nearly due to the complete dysfunction of a large segment of the bowel. So it is not a good patient for the new graduated nurse. So number 3 is not an answer. Number 4, here say a client returning from surgery with a sigmoid colostomy is at the risk for post-operative complications and should not assign to a more and should assign to a more experienced nurse, not a new nurses. So only patient number 2 is a stable and we allow to give to a new graduated nurse, right? Because this client is being prepared for a test. That's it.